Hello everyone, my name is Amelia Azam, and today I will discuss on how dietary intake of medium-chain fatty acids can reduce inflammation of the pancreas. The purpose of this video is to describe what happens to the body when people consume medium-chain fatty acids. First off, I will start with some background information about medium-chain fatty acids in digestion. For example, coconut oil is heavily promoted as a healthy oil which supports different kinds of diseases. Edible oils and fats are vital to the human diet for absorbing fat-soluble vitamins like A, D, E, and K. Fats and oils are made of fatty acids, carbons, hydrogen, and oxygen linked together to a glycerol backbone. When consuming fatty foods, the fatty acids are separated from their glycerol backbone during digestion. This leaves fats and oils available to the body as fatty acids. In the next slide, I will explain the naming and classification of fatty acids. I wanted to mention the information on this slide as a review of the naming system of triglycerides. Fatty acids differ from one another by chain length and degree of saturation. What this means is that carbon chains are saturated or filled with hydrogen. Meat, poultry, dairy, eggs, coconut, palm, and kernel oil are all foods full of saturated fat. Digestion and absorption depend on the length of the chain. Chains can either be long, medium, or short-chain fatty acids. The image to the right is a visual of foods that are categorized as long, medium, short-chain fatty acids, as well as omega-3 and 6. In the next slide, I will go into detail of digestion of long and medium-chain fatty acids. Long-chain fatty acids are the most common fatty acids we consume because they come from meat and dairy. They require special pancreatic enzymes for breakdown. They are absorbed into the intestinal wall and packaged into bundles of fat and protein called lipoproteins. These lipoproteins are transported by the lymphatic system, bypassing the liver and then released into the bloodstream where they are circulated throughout the body. The lipoproteins get smaller and smaller until there is little left. During this time, the lipoproteins are taken up by the liver and used to produce energy. Cholesterol, saturated fat, monounsaturated fat, and polyunsaturated fat are all stored together in lipoproteins and carried throughout the body this way. The saturated fat in coconut oil is unlike the fat found in meats or other commonly used vegetable fats. It is nearly identical to a special important group of fats called medium-chain fatty acids. The medium-chain fatty acids found in coconut oil are rapidly absorbed directly from the intestines into the portal vein and sent straight to the liver where they are used as fuel. These medium-chain fatty acids are not enveloped into lipoproteins but are directly converted into energy by the liver. They are not stored to any degree as body fat, unlike long-chain fatty acids. Basically, medium-chain fatty acids produce energy. Other dietary fats tend to produce body fat. Reducing the amount of energy needed by the pancreas, you can reduce symptoms associated with pancreatitis, which can turn to relieve symptoms and reduce health risks associated with diabetes. The first study I found was by Child and colleagues. Basically, patients with increased plasma triglyceride levels are at risk for developing serious complications such as pancreatitis, coronary heart disease, and stroke. Their studies successfully used an acute treatment in a number of patients with hypotriglyceridemia-induced pancreatitis. It showed effectiveness in rapidly and safely lowering plasma triglyceride levels in these patients before admitting them to long-term drug therapy. Patients ate a very strict diet of low sugar, plain foods like bread and vegetables. At the same time, they were treated with a formula composed of medium-chain fatty acid oil, omega-3s, and protein. The results of this study is that all the patients' triglyceride values decreased within 7 days of treatment. In my second research findings, Shaw and her colleagues investigated the use of medium-chain fatty acid oil for pancreatitis patients to reduce pain and inflammation. They used patients with chronic pancreatitis and supplemented a medium-chain fatty acid formula 3 times a day for 10 weeks. What they found was the absorption of medium-chain fatty acid in their trials reduced the patient's pain levels. So why should we care about this subject? The pancreas is an organ located behind the lower part of the stomach, in front of the spine, and plays an important role in diabetes. The pancreas is the organ which produces insulin. one of the main hormones to help regulate blood glucose levels. Anti-inflammatory foods are significant for the diet. Long-term consumption of medium-chain fatty acids can essentially reduce your risk of developing diabetes or slow the progression of the development of the disease by balancing blood sugar levels, as well as improving insulin secretion as long as the pancreas is healthy. Inflammation of the pancreas would stop insulin production and therefore cause diabetes in patients with pancreatic inflammation. Another reason is that swelling is the result of increased movement of fluid and white blood cells to the area of inflammation. The release of chemicals and the compression of the nerves in the area of the injury may cause pain. With more research, medium-chain fatty acids can be used to treat other inflamed tissues and organs.